Sunday marked Iran's single biggest jump in deaths, rising more than 100 to 724 overall. There are now 14,000 confirmed cases. Iran is believed to have 110,000 hospital beds, 30,000 of those in the capital, Tehran. The country was already under pressure because of US sanctions, and with the outbreak placing further pressure on medical services, the government has asked the International Monetary Fund for $5 billion in emergency funding. Also, President Hassan Rouhani has offered low-interest loans and cash handouts to ease the financial burden on millions of households. So for more on this, we can speak to Trita Parsi. He's the Executive Vice President of the Quincy Institute, joins us live via Skype from Reston, Virginia. First of all, the figures in Iran. We were talking about a death toll there of 724, 14,000 confirmed cases. Are the real numbers likely to be higher?
It is highly likely that the numbers are higher. How much higher, we of course do not know. In the beginning, the Iranian government's response to this was quite inadequate, if not completely incompetent. As of late, you've seen them taking much more drastic measures, but they have an additional challenge which other countries do not have, which is that because of the impact of sanctions on the economy at large, as well as when it comes to their healthcare system, their ability to test and verify cases is going to be a bit more limited than what it is in other places. And that will contribute to the undercounting.
I definitely want to get into the effect of sanctions, but I mean, as you say, there is a shortage of testing kits and medical supplies, and they face this awful pressure from US sanctions. But what more could the government do in terms of domestic policy? What could they have done, and what can they do now to alleviate the impact from that?
Well, the first things that they should have done in the early stage, which is, of course, a little bit easier to say in retrospect, because now we know how devastating this virus can be and how quickly it can spread. But they did not, for instance, postpone the elections. They did not postpone some of these events that take place that are the opposite of social distancing. And they seem to have not taken the virus seriously enough. And that appears to have created a scenario in which it spread much faster inside of Iran than it otherwise would have. And as a result, now they have a much more massively difficult situation than most other countries. Now, of course, when you take a look at it, Italy is pretty much in the same situation, although they've taken very drastic measures as of late. But it shows that even in countries in which the response would probably have been better and also are not facing these type of difficulties such as sanctions.
I want to ask you then about the sanctions, because you have European countries not selling supplies or testing kits to Iran. They fear the impact of sanctions. And then I'm sure you've seen this story about Google removing Iran's coronavirus diagnosis app from their store, from their online store. What does that reveal about the impact of politics and the fight between Washington and Tehran on the fight against the virus?
Well, it means that when Trump is talking about pursuing economic warfare, we should take him at his word. This is economic warfare. This is impacting the entire population and clearly impacting poorer segments of the population. And it is indiscriminate. You cannot have sanctions on entire banking systems and all financial transactions and then claim, yes, but medical supplies are exempt. Well, even if the specific medical items are exempt, it doesn't mean that people can still buy them, because they still need to have access to the banking system in order to be able to buy them. Human Rights Watch, for instance, has documented this and shown that this is a violation of the ordinary peoples of Iran's human rights. And that is what
what needs to happen? I mean, is that likely to be rectified anytime soon? Because obviously, I mean, everyone is completely preoccupied and absorbed. I mean, Western countries are really facing their own battles right now. I mean, is there likely to be any kind of political or legal clarification on whether Iran can access money from the International Monetary Fund or any kind of international aid to deal with this?
Well, they have requested money from the IMF, and it's going to be quite interesting to see what the IMF's response to this is. And if the IMF approves this loan or this support, how will it transfer the money over to Iran? I mean, this is the same problem that has existed for quite some time now, that even when things are exempted and are approved, the banks still will not touch them because of their own fears of getting sanctioned by the US government. So it's a test case to see whether there will be exemptions made and whether there will be any humanity within this economic warfare that Trump is waging right now.
Thank you very much from Reston, Virginia. Trita Parsi, thanks. How much more pressure are people feeling now?
Well, certainly the sanctions have, for many, many months, had a compounding effect even before this outbreak. And really, the cracks are beginning to show because the public health care sector is under a great deal of strain, and Iran simply doesn't have any extra money to throw at the problem. So a great deal of pressure, and the pressure could be getting worse. Tragically, today, yet another record-setting day with the death toll spiking, the number of cases spiking, and Tehran remains the epicenter of the problem here in the country. Tehran province, as well as the capital city, Tehran, this is where the bulk of the cases are. But the government continues to say, despite the fact that we were expecting the military to enforce controls of mass gatherings and other crowd control measures, the government of President Hassan Rouhani continues to say that there will be no quarantine of the capital, that they will try to maintain business as usual as much as possible. They continue to advise people to stay at home, but they say that shops and road closures, that will not happen. Now, they have announced a new phase that is coming up, that they will begin temperature screening at the city limits of Tehran for any car passengers that are coming in and out of the city. Now, we did hear another bit of concerning information from the task force that has been assigned by the president to combat the coronavirus, and that is that a handful of 15% of the deaths have happened among people considered to be younger than this has been, than the coronavirus has been killing most recently. So what the healthcare official attached to the task force said specifically, the virus in Iran is, quote, deadlier and wilder inside Iran, suggesting that there is a more virulent strain of the virus in this country. Of course, it was already a concern for the aging population, but this is a country where the majority of the population is considered young. The median age is 31, so this could have a compounding effect if it is verified and if it is not an anomaly.
Thank you very much, Zein Basravi in Tehran.